Hi guys, I hope you enjoyed having your Monday off and that you enjoyed not having to get up super early and you can watch this at your own leisure. Today we're going to talk about developing a rehabilitation plan. So, what needs to go into the plan? Well, obviously a rehab plan needs to be well thought out and it's going to be designed with care. So you need to think about your patient, which I think I have said 70 million times, and so you got that. What should it include? When you're putting together a rehab plan, while it is about the patient, what you need to understand is the injury itself. So how did it happen? What occurred? Has it happened before? What anatomy was involved? So is it a ligament? Is it a muscle? Ligaments the patient will hear a pop, and often it's a different sensation than they describe with, say, if a muscle was injured where it's a pulling sensation. You need to understand the severity of the injury. So for instance, a grade 1 ankle sprain where someone says they just sort of stepped off the curb and they rolled their ankle may only swell a little bit, and then it's just a grade 1, so the ligament will heal up in 2 to 3 days. The bruising will go away and the patient will pretty much be able to function pretty functionally. If it's a more serious injury, for instance, a grade 3 ankle sprain, you may have an ankle that is super swollen, black and blue. The patient cannot bear weight. They may need to see a doctor, or surgery may need to be involved. And so all of those details really play a role in putting together the rehabilitation plan. And finally, you need to understand what stage of healing the patient is in. So in this lecture, I am actually going to review the different stages of healing: inflammatory, remodeling, and repair. And I've mentioned them in class a few times, but we are actually going to see them in this lecture. So the goals are key. Basically what that means is they are the most integral part of your rehab program. You need to have some short-term goals and some long-term goals, and it needs to be a team effort. So you and the patient need to get together and figure out your long-term goals. So for Joe, we know that his biggest long-term goal is sand volleyball. If we had a baseball pitcher who blew out his elbow and had to have Tommy John surgery because he destroyed his ulnar collateral ligament on the medial aspect of his elbow, his long-term goal would probably be to return to pitching, and to do that with a lot of velocity and control. And so that would be something that you would want to work on with that patient. So you'd want to talk to the patient about his or her sport or what their activities of daily living are, and come up with some short-term goals and a long-term goal. Now, it's important that the short-term goals are attainable so that the patient feels like they can reach those goals by just working a little bit harder, and they can see that they're reaching those goals. They need to be measurable. You need to be able to say, okay, today, Mr. Tommy John athlete, you're going to work on bending your elbow to 50 degrees. You've been stuck at 45. Today we're going to use our goniometer. We're going to line it up on your elbow. We're going to measure it, and we're going to see where you've gotten to over the last week since we've been doing all this stretching with you. So having numbers, seeing the changes are really, really helpful for patients. So short-term goals are your patient's own personal roadmap to getting better. So they need to be in bite-sized pieces, so little pieces. So short-term goals, like I was just said before, changing even 2 or 3 degrees following a surgery that's pretty substantial is big. So that can be written down in your SOAP notes with your patient. Our patient's goal is to improve elbow flexion 5 degrees in the next 2 weeks, and that would be a great one. Okay. They need to be linked to the problem that the patient is seeing you for. Obviously, you can't throw a baseball if you can't bend your elbow, right? So that makes good sense. They need to be customized for that patient. So if you have a patient at Toyota who had Tommy John surgery, because all different people can blow out their elbows, maybe one of your short-term goals for that patient, their long-term goal may be, I would like to be able to get back on the line at Toyota and continue to fix the windows that are put in the car. In order to do that, I need to be able to bend my elbow 110 degrees. Okay, so your goal for that particular patient might say that you are working on elbow bending to get back on the Toyota line. So, it makes sense. It needs to be part of your patient's mission to get better. So the other thing, of course, which you guys probably know, is that you want to keep everything really simple. So follow that KISS principle. Follow goals that the patient can understand. So here's an example of a short-term goal for a swimmer. So the biceps tendon, if you remember from anatomy, is in the anterior aspect of the shoulder, and it attaches, the long head of the bicep attaches to the superior aspect of the labrum. And so often, if you have a patient who has shoulder injuries, they will have pain in their biceps tendon and pain in their labrum. Okay, so we always want to consider that. The long-term goal of this swimmer is to swim a 200-meter freestyle in the high school state meet. So say that's 3 months away. The thing about swimming is that it's just not about the 8 lengths that you swim during your event. Nope, it's not. There's a lot of swimming that takes place before then. So one of the things that we know from the research is that technique plays a big role in a swimmer's ability to swim with no pain and to swim fast. So one of the things we are going to work on with this particular patient is to return them to the pool working on a high elbow recovery and a good pull through underneath their body, which is proper swimming technique. So that's a small goal. And another small goal would be to swim a full 200 meters during practice in 3 minutes without increased pain during the swim or after the swim. So the quantitative part of this goal is the amount of laps that the patient swims, but it's also the time they swim in. So that for that patient, a 3-minute 200 meter might be a very good time. So each swimmer would swim at a different time. So that would be a good way to get them back to do an 200 meter free in the actual meet. So they're slowly but surely working on stroke technique to decrease pain in the shoulder and working on a little bit of speed to make sure that they're ready to go back in. All right, so here's the meat and potatoes of this lecture, the phases of rehabilitation. So if we've talked about the preoperative phase, I call it the prehab phase. And so that usually occurs during the acute or inflammatory phase. We also have the fibroblastic repair phase, which you may see in other books called the proliferative phase, and the maturation remodeling phase. So these 3.5 phases of rehabilitation are the key healing phases that the body goes through following an injury. So the first phase is called the inflammatory phase, and it usually occurs from the first 1 to 4 days that a patient is injured. And depending on what book you look in, you may see 1 to 7 days, 1 to 5 days, but it's within the first week, and it's crucial that in that first 48 hours, we try to control inflammation, that we let inflammation happen, but we control it, and we've talked about this. We use police, and we talked about that too. And our goal is really to regain homeostasis. And homeostasis is just the balance within the body, making sure the cells are back to where it needs to go. What happens during the inflammatory phase is there's injury to the blood and the lymph vessels, which is what makes things turn black and blue. There's a change in blood flow, and there's often drainage in terms of drainage fluid, white blood cells, damaged blood cells from the injury site. Okay, so don't freak out now. I don't want you to freak out. But basically, what we're going to talk about in the next couple of slides is I'm going to review the actual physiology that happens during the inflammatory phase and all of the other healing phases. And I want you to listen to this, and I want you to appreciate it, and I want you to take a deep breath because it's really interesting, but you don't need to memorize this now. You will need to memorize this in graduate school, and you will need to understand it because it is really the key foundation of rehabilitation. And it's kind of neat. So, what happens? First, we have vasoconstriction, so the blood vessels constrict, and then they dilate, so then they open up so blood can go whoosh, rush into them. The next thing that happens in a nutshell is platelets are released from the blood. So platelets, you remember from grade school, platelets lay down and they are used to clot different injuries. And then fibronectin and growth factors are released. These are all chemicals that are released from the bloodstream. Fibrolysin is released. And then finally, debris is removed. And debris is removed from white blood cells. So the macrophages and the leukocytes and the lymphocytes, they're like little Pac-Men, and they come into the injured site and they eat up all the damaged cells. And that helps the inflammatory phase and the inflammation go down. There's also a chemical reaction happening at this time. So there's a reaction between the cells and the chemicals, which is how we have this vascular permeability. So that's what happens when vasodilation occurs. And what happens is histamines and prostaglandins are released, and those are those white blood cells, and that's what helps with the decrease in the swelling. That's the only level you need to know this on, okay? The cool thing about that is that this helps blood flow to the area. New nutrients can flow to the area, which helps heal it. It attracts leukocytes, which are white blood cells, which also help to heal the area, help to nourish the blood, the damaged blood cells in that area, and help new little fibro blood cells to be formed so that more blood can be healed. Okay, so all that's happening on the inside of the body, but on the outside of the body, what you basically are going to see is redness. And that's due to all that cellular activity within where that injured area is. You see heat, okay, so that's also, you can feel the heat. You can't see the heat unless, I don't know, you have like Superman heat vision, but I don't have that. But you can feel the heat if you put your hand over top of where the scar is and you have increased cellular activity, okay. There's also pain, and I talked about that the other day, how like when an area gets really swollen, it causes increased pressure on nerve fibers, and then it sends a message to your brain, and then it hurts, and it's no fun. Okay, and we also have what's called decreased function, which is a withdrawal reflex. So that sort of goes with that idea that people don't want to move a joint or a limb or an area of their body when it hurts, right? Why would you want to do that? Okay, so that's what you see. So you couldn't get out of this without an assignment. So here's your assignment, your first assignment 1. So this is where I want you to think about the inflammatory phase. This is the purpose of this, right? So we have Joe. He's at 1 to 4 days post-op, okay? So what do you think you should be doing with Joe? What kind of activities or not activities do you think you should be doing with Joe? So I want you to pick 4 key exercises that you would like to do with Joe. So the hint on this is that you're going to actually have to go into your book and read it, and you should read chapter 16, okay? And what I want you to do is I want you to open a Word document, and I want you to think about what you would do with Joe days 1 to 4 and provide just a really brief explanation. I'm talking like 1 to 2 sentences explanation, what you're going to do with these activities, and you're really lucky because you are in like the best physical therapy athletic training clinic in the entire world, and you've every single type of resource you could ever need, okay? So that's your first assignment. So you can like stop this PowerPoint, and then you can start it again. You can start it right at this side, right after you finish your first assignment. There's 3 assignments altogether, and they can all be done on one Word document to upload into Blackboard. Okay, so you're all set with Joe during his inflammatory phase. You know it's happening. You know it's happening inside of his knee, and you know how you want to fix that or help Joe. So now we have the fibroblastic repair phase. So this could be day 4 to like month 9 or to month 6, depending on your biology of your athlete and how they heal. Okay, and the goal of the fibroblastic phase is 1, to repair the area. That's like not surprising since it's called the repair phase, right? So rebuild the specific tissue that's injured. And then also the goal of rehab is to begin motion and aid blood flow. Okay, but it's really important. So this is the part where like the patient starts to feel a lot better and their swelling goes down and they want to bend their knee and they want to go run around and they want to take their brace off. But inside their knee is not necessarily healed yet. So you need to be very, very cautious with these patients. And here's why. This is where angiogenesis takes place, which is basically where the fibers in the knee, the ligament, the muscle, all starts to like come back together and all the scar tissue is starting to get laid down in a more organized way. So the fibroblasts are little baby blood cells, okay, and they create little immature blood and muscle cells. And at that time, an extracellular matrix is laid down. And an extracellular matrix is kind of like, the way I would picture it is like if you took a whole bunch of molasses and then you took a whole bunch of granola and put it on top, and then you laid hay on top of that, just a total mishmash. Got that visual? Totally random, I know. That's what an extracellular matrix looks like, okay? And from that, that's sort of like solid, but not necessarily, and it's really disorganized, right? It's like a total mishmash of just stuff. So what happens is that during this repair phase, as you start doing exercises and putting stresses on that joint and that injured area, that scar tissue actually starts to straighten out and become a little bit more parallel. So those pieces of hay sort of become more parallel and in line with each other. The oatmeal sinks into the molasses, and you get what's called a type 3 collagen, which is not necessarily a super strong collagen, but it is the first layer of scar tissue that's laid down. Now, over time, as you do your rehabilitation, that type 3 collagen actually morphs into a type 1 collagen from the stresses that are placed on it. And that is the physiology of the repair phase in a very basic nutshell. Again, this is our chemical reaction that's happening in your body. So your GAGs are your glycosaminoglycans, okay? And they are part of that ground substance or the molasses, hay, granola analogy I made up, okay? They hydrate the area. They release collagen fibers in order to create more scar tissue. And the cells are blast type cells in that area. So blast type cells are baby cells. They're immature cells, immature blood cells, immature muscle cells. If it says blast, it's a new cell that's just being born for that area. So they can be fibrous or non-fibrous, but there's lots of new cells in the area that are being born in order to help the area repair itself and strengthen it up. So what are our thoughts on the fibroblastic repair phase? Well, with your patients, you want to really take your time working with your patients. And I already mentioned this, okay? What you need to be concerned about is the size of the injury, where the injury is. So on the knee, it's pretty easy, right? Like you can protect the knee, you can put a bandage on it, everyone can see it. But what if your injury was like in your armpit? It would be hard to see it, right? And it would also, you'd have to worry about friction and things like that. So you need to be concerned about where the injury is, where the surgery is, how large it is, what part of the body it's on, okay? And the different types of tissue in the body. So ligaments tend to heal a little differently than muscles do, tend to heal a little bit different than tendons do. So you need to be aware of that. The other thing that we're going to really stress, in this is using the stresses to pull the tissue into a functional alignment. So if you're thinking about a Tommy John surgery and you're thinking about the medial aspect of the elbow and you're thinking about throwing, you need to move the elbow in the direction that a throw would be. So we first need to cause a functional alignment of that ligament. So we know that that ligament goes from the superior condyle of the humor, of the humerus, it's very humorous, the humerus down to the ulna. And we know that if you look at a ligament under the microscope, the fibers of it are parallel. So we want to do rehabilitation, stretching, strengthening really lightly to realign those cells and the new fibers so that they're parallel, because that's the way that the elbow works. So you need to have the appropriate tissue pull. Okay. So what are you going to see? So when you get to this phase, like I said, this is where people get excited. So the swelling is almost gone, which means that there's a decrease in redness. There's not as much pain, and there's more motion because there's less swelling to hinder that. Okay. The scar itself may still be a little warm, and that's just due to the excess cell activity, the body working on it, and it still may be a little tender to touch, but for the most part, it should be pretty good. So let's think about Joe. Okay, this is assignment number 2. So we got Joe now here. Here he is. He's 2 months post-op, so he's in this fibroblastic phase. His pain is a 3 out of 10, except after PT when he goes home because he's like kind of sore, and so then it goes up to a 6 out of 10 because he works really hard, so he wants to get back to play. So he ices and he elevates, but he is not losing any sleep at night, okay? He's like totally feeling way happier than he was feeling before. His spirits are better than they used to be. His knee extension is 0. He has full extension, so he's allowed to walk. And he has 110 degrees of knee flexion, which is great, but ideally we want to have him at like 120, 125. He's out of his brace. He's full weight bearing. He's working on his walking, but he needs to be careful. And his next mission is to gain some strength. So your mission is to write 2 short-term goals for Joe. Not for goal. He has a goal. 2 short-term goals for Joe. We know his long-term goal is to return to sand volleyball. That's like not a secret. So I want you to think about these 2 short-term goals for Joe in this phase and write them down. Have at it. Look in your book. It's helpful. Now here we are at the end, remodeling phase, okay? So this could last for a lot of years, okay? The remodeling phase could last, depending on the biology of your patient, oh my God, like a year to 2 years. That's why you see doctors prescribing things like those defiance braces that go on people's knees following their ACL surgeries. What we really want to work on with this is reestablishing tissue stability and the structural arrangement of the tissue. So we really want to make sure that the tissue in the healthy leg and the tissue in the unhealthy leg look very similar. Of course, you can't look under a microscope to figure that out unless you have like x-ray vision. Again, not Superman, can't do that. So we just have to trust our rehabilitation. We need to work on increasing muscle strength, and that can get measured using quantitative goals, using manual muscle testing or a handheld dynamometer, okay? And you want to begin those functional activities and those proprioceptive activities like we did in lab. So the remodeling phase, myofibroblasts occur. So myo meaning muscle, fibro meaning blood, blast meaning new, okay? As the muscle cells grow together, the wound contracts, so that's good. We got a good healing scar. We've increased collagen transition into a stronger collagen, and then we have increased capillary formation, so that's even more new little blood cells being formed in the area to strengthen it up and help it get stronger. What you're going to see on the outside is you're going to see like almost a pretty normal, for Joe, knee, right? So decreased redness, decreased swelling, pain over the scar area, gone. Scar itself, much smaller, especially if they use that vitamin E or that scar go away stuff. Okay, so the goal of remodeling is to regain activity-specific skills. Often, the patient is working on a lot of strengthening during this time, still working on range of motion, but starting to work on these more functional skills like jumping up on a box or hopping from side to side as they progress, as they get stronger. Okay, so I'm not going to tell you what Joe's going to work on because you're going to do that yourself. Okay, so here is our assignment 3, looking into the future. Look into the future. So we got Joe. We know he's only 2 months because you've been working with him, okay? But this is the last assignment, and I want you to have some fun with it. So go onto YouTube and find a clip of a men's sand volleyball tournament or something or other, okay? And I want you to copy that link and put it on your Word document. And I want you to watch it, and I want you to take a look and see, like, what are the demands of sand volleyball. So you need to get a real clip. It can't be like a silly clip, okay? So we want you to get the demands of sand volleyball, okay? What are they? Do they run around a lot? Do they jump a lot? Do they slide a lot? What kinds of demands, when you're thinking about specific imposed adaptations and demands, what are they? Think about the SAID principle, okay? Write those down. I want 2 or 3 of those, okay? And then I want you to think about 2 exercises that you can do with Joe when he gets into the remodeling phase. And the reason that's going to be good is because eventually we can go back and look at those, and we can break them down into smaller bite-sized chunks and make them into small goals and small exercises as part of your rehabilitation plan. And that will help Joe be more compliant because he will feel like, whoa, my PT really likes me. My athletic trainer thinks I'm important. He or she knows about my sand volleyball and wants to work with me. And then you and Joe become a team, and it's like totally awesome. And that's the end. So thanks for sitting through this very entertaining narration of our PowerPoint where I made lots of mistakes and stumbled over my words. And hopefully you all laughed at that because it's great. And I will see you in class on Wednesday. And that's it. Have a great day.